Welcome to the Heroes Initiative powered by IPCA. These heroes are instrumental in improving quality of life of the patients. Today we have one such hero who has improved life of tens and thousands of such patients. Doctor, we welcome you to the Heroes Initiative by IPCA. Doctor, are glaucoma a silent killer? My first question for you is, what are the early signs for glaucoma and how can it be detected before any significant damage occurs?
The patient will face multiple times headaches and pain in the eye. He might see colored halos around an object or like a rainbow around a light source. Red eyes is very common. Also, whenever the pressure rises, patient will face nausea, vomiting. Vision loss is also there, blurring of vision. Some patient faces some blind spot while working. So these are the common things which early we can detect.
What are the risk factors for glaucoma and can it be prevented or slowed down with the lifestyle changes or medication?
There are multiple risk factors. The most common thing that we find in our patients is the family history. So it is a hereditary condition. So always we have to see if anybody in our relation or family is having glaucomatous condition, he is more susceptible to have a glaucoma. Other than that, elderly patients whose age is more than 55 years, diabetic patients, patient is having hypertension, some patient who is having thin cornea, and those who are having high intraocular pressure. Also, many patients use the steroid eye drops for a longer time. They are also susceptible for glaucoma. If you have any history of trauma to the eyes in the past or any history of surgery, they can also land up in the secondary glaucoma. And one more thing is some of the patients who have the obstructive sleep apnea syndrome, they are also more prone to have a glaucoma. So about the prevention part, so what can we do to prevent this is we have to do a regular eye checkup. We have to visit your ophthalmologist regularly. We need a healthy lifestyle for it. Like we have to monitor our weight, blood pressure, and the sugar level. We need a proper exercise, yoga for that. A diet should be maintained. It should be rich in multiple vitamins and minerals. We have to limit our caffeine intake, and that also leads to increased pressure. We have to use our glasses properly, protect our eyes in working condition to avoid any damage or trauma. And most importantly, we should know our family history. So anybody in family is having glaucoma, we should be knowing about it. And diabetic patient, they should always control their sugar level, and they should properly take the proper treatment for the sugar.
Agreed, doctor, what you said. How often should I get my eyes checked for glaucoma, especially if I do have a family history of the conditions, doctor?
See, if any patient is having a family history, the first visit is very important. In that visit, we'll evaluate everything. If any pressure raise is there or any changes in optic nerve is there, we'll check his retina, all the condition. If needed, we'll check his perimeter, that is fields of the vision. So if everything is normal, then we'll ask the patient to regularly show every 6 monthly to the ophthalmologist. If any times we find any changes, then we can evaluate accordingly.
So doctor, your expertise and insights on glaucoma, a silent killer, are invaluable to this initiative, and we believe your participation will greatly benefit the patients.